Good afternoon, everyone, and thank you all for joining us this afternoon. My name is Clay Teague, and I have the pleasure of serving this year as the Northern Ohio HIMSS Chapter President. I'm very excited for today's webinar as we have a wonderful guest, Tom Campanella, with us to speak with all of you on the topics of healthcare transparency. I think we all can agree that this is a very timely topic for our industry and for the healthcare industry as a whole. I'd like to kick off today with giving a quick introduction of both our speaker and one of our actual colleagues on the board itself here at HIMSS, who's actually going to help us through this question and answer type format that we're going to do today. So again, our format of the interview today will be a question and answer format. To make this possible today, I want to start first by introducing Larry Voighton. He's our advocacy chair on the HIMSS board. And Larry has actually graciously offered to join us today to help navigate through this webinar in this format that we're putting on.
Good afternoon, everyone.
Thanks, Larry, for being here. With that being said, I'm going to go ahead and jump into Tom, our pleasured guest that we have today. Tom is a healthcare executive in residence at current stay at Baldwin Wallace University here in Cleveland, Ohio. Tom was previously a director of healthcare of the MBA program and a professor of health economics for the Baldwin Wallace University. He teaches and speaks on health policy and finance issues at the regional and national level. Tom writes blogs, white papers, conducts webinars on a variety of healthcare related topics. Tom's postings are on LinkedIn and they are also emailed to readers monthly. So please look out for that and connect with Tom on LinkedIn. I'm sure he would love that. Tom is the president of Campanella Consulting, Inc., where he advises clients in a diverse sector of healthcare. He's also retired from the law firm of Baker Hostler as a counsel specializing in healthcare law. Previously, he served as Associate Dean of Clinical and Community Services for the Ohio University Osteopathic Medical School and Chief Operating Officer of their 5 clinical sites in southeastern Ohio. Tom was also the Vice President of Healthcare Finance and Care Management for Blue Cross Blue Shield of Ohio Medical Mutual from 1985 to 1997. And prior to that, he was a consultant for Ernst & Young. Tom has his BA and MA in economics from the Ohio University and has his law degree from the Cleveland State University. He is also a CPA and is licensed by the state of Ohio as an agent to engage in the business of health and life insurance. So we are so excited for Tom to be here today and really look forward to this webinar. But before we kick off and I turn it over to Tom and Larry, I wanted to take a minute here to cover a few housekeeping items. As we go through the webinar, please take the time to post your questions on the sidebar in the comment section. And we're going to try to save about 10 minutes at the end of the conversation to answer some of those questions for you. I also wanted to bring up that we do have another upcoming in-person event on November 17th. This will be held at the Akron Infusion Center at Akron University. We also understood, due to the climates in which many in our healthcare organizations are under financial constraints, we have decided to hold this as a free event to give back to our members. We look forward to seeing you there, and registrations will be coming out very soon. And also just know that we will be posting that registration link in the comment section today to make it easier for you all to be able to grab it. So without further ado, Larry, I will turn it over to you to Tom, and we will go from there.
Thanks, Clay. Well, this format for today is going to be a little bit formal and a little bit informal in that I'll be reading some of these questions, if not all these questions. Tom and I go way back. We've consulted in past lives and have seen each other socially. So this is a great opportunity for me to be able to interact with him. So Tom, let's get going here. Essentially, why do you believe it is important for our members, especially our Northeastern Ohio HIMSS members, to understand the factors that are impacting the changing landscape in healthcare, and specifically the role of healthcare technology in separating the winners and losers from this new world of healthcare?
Thank you, Larry. And as always, it's great to have a discussion with you. The way I look at it is healthcare, and I love analogies, it's like a puzzle. And all of us, both as it relates to both ourselves individually, but even the organizations that we're in, are sort of one of the pieces of the puzzle. But like any puzzle, you really need to have a better understanding of all the other various pieces to be able to really have sort of a broader understanding of what's happening in healthcare, why it's happening, and where it's going. And it becomes even more important for people, I believe, in the field of technology to understand that. Because as we'll discuss further today, but the fact is, the new world of healthcare, technology's role is going to be increasing tenfold. Both from, you can look at it from a provider standpoint, hospital or whatever, the technology, the ability to be able to deliver healthcare, the ability to be able to, from companies and organizations, to be able to facilitate user-friendly data, and so that we can better understand healthcare, for medical device companies, for everything. Healthcare technology plays that role. But if you are in working in a health system, like say in the systems area of a major hospital, for an example, and you're just focusing on what you have in front of you today, you need to really go beyond that and really look at yourself as trying to understand that bigger picture, so that you're just not reactive to what users come to you in regards to potential solutions, but you're actually proactive with ideas to be able to address the challenges that both your organization and your sector is facing in healthcare. And to do that, you have to have that knowledge. So you got to get beyond your piece of the puzzle. And we're going to be talking a little bit about that today as it relates to price and quality transparency.
Great, Tom. Can you provide us with an example that illustrates the importance of understanding the world of healthcare beyond your and your organization's piece of the puzzle?
Well, I think a simple example is actually care in the home setting, which everybody is talking about, the hot issue that's occurring out there. Well, way back when, around 2018, and I was far from a rocket scientist in regards to this, I wrote a blog, and basically I called Care in the Home Setting, the New Frontier of Healthcare. And why did I have a sense of this? And again, this was prior to COVID, was taking a look at and trying to look at the issues or the external factors beyond my particular puzzle piece. And I saw a number of different factors that basically told me that care in the home setting was going to become a major focus of healthcare in the future.
Thanks, Tom. Can you explain further how you predicted that there would be an increase in demand for in-home setting care and the role of technology in this trend?
Well, Larry, the way I look at this, it's sort of like a chicken and egg phenomenon occurring when providing healthcare services in the home setting. But this would apply in any other scenario where ultimately what was occurring is active purchasers. And this could be employers, it could be health insurance companies, it could be Medicaid programs, Medicare, where, as a result of the escalating high healthcare costs, we're really challenging and looking and promoting for healthcare services to get to, in effect, the lowest cost setting. And when you think of inpatient hospital, obviously that's the highest cost setting. And when you looked at the setting of the home, it was actually in many ways the lowest cost setting. But the big challenge was, can you provide this healthcare in the home setting? Can you have the ability to diagnose, provide, and monitor care in the home setting in a safe and quality manner? And this is where the chicken and egg came in, because conversely, the medical device, pharma, and technology companies, as they were looking at healthcare, they were basically saying, hey, we have the ability to address that issue, to be able to diagnose, provide, and monitor, but we have a capitalistic system out there. They're going to be making millions of dollars of investment. They had to know that they were going to be paid for it, and that it wasn't just a short-term phenomena, but it was a long-term side of it. So when the two sides basically connected and they recognized that, yes, this was a need, and yes, it was long-term, then ultimately the technology, durable medical, and all the other areas really responded. And the bottom line is we have today. And this all started before COVID. Obviously, COVID ramped that up. And the other key message here, as COVID wanes down, this is not going to go away. So right now, as you know, they're talking about hospital and homes and stuff like that. And then the other external factors, obviously, are the aging society, the aging baby boomers, demand for care in the home setting, as well as the big focus on social determinants of health.
Well, let's get into the topic for today, Tom. Much discussion has occurred over the years about the need for price and quality transparency in healthcare. We talked offline about this before, that currently I'm getting more information now about my services than I did in the past. That discussion is now becoming a reality with the passage of the Health Price Transparency Rule and the related Transparency and Coverage Final Rule. Can you briefly explain these rules so our audience can catch up on them?
Okay, and I'm definitely going to briefly explain it because obviously there's a lot of detail into this. But ultimately, effective January of 2021, and this is what you were starting to see, hospitals, it was basically CMS and through and working with Congress and that wound up passing this transformation. And it had really bipartisan support, both Democrats and Republicans in regards to transparency. And ultimately, they were focusing initially on the hospital side of the equation and publishing information available to the consumers. The big issue that is really, I think, going to shake up the system is initially then the other part of this was as it related to group health plans and health insurance carriers, and that as well as self-insured employers. And this, as of July 1 of 2022, they were required to have machine-readable files for pricing. The practical aspect of this was really more behind the scenes. Consumers and employers themselves, this really isn't relevant information. It sort of laid the foundation for providing better transparency. Mm-hmm. The keys then, and really where the disruption or the real change is going to be occurring, is as of January 1 of 2023, 500 shoppable services are needed to be posted. And it's not just what the copay is and what deductible, but what the actual negotiated price is. Both if it's a fully insured, the health insurance company would need to be able to list this. And then if it's self-insured, the self-insured employer will more than likely delegate it to either a third-party administrator, their vendor, or it could be the health insurance company that's acting in that role. And then in January 2024, all services, not just 500, need to be published. And this will be in a user-friendly. So just as you already probably see in some websites of your health insurance carriers that you might have, Anthem, Medical Mutual, or that, mm-hmm. where they show comparison. If you go to Cleveland Clinic, the price is X for an MRI or for a knee replacement. If you go to this facility, it's a different one. If you go to an independent provider, it's this one. And you're basically that's going to be the type of format that will be available in the future.
It's going to open up all our eyes here, Tom.
You got it.
So why do we actually need this price transparency?
Well, when you think about it, Larry, price transparency is a really key stepping stone achieving our overall goal, providing care. Because when we talk about it, and really I'll talk into quality too, obviously, but it really sets the stage for that. And the other part of this is to be able to have competitive healthcare markets, you really need to be able to understand pricing. Can you imagine going out there and buying a car, buying a computer, buying a cell phone, and not knowing the prices? How in the heck can you do that? And so you have to have that. So with that information, now all of a sudden, the consumer, the payer, the employer, and that now have the power that they never had before, where they're going to have the ability to choose. And the challenges obviously is going to come on the supply side, or in this case, the provider side. And then and when you think about, like I said, in other sectors, this transparency has really transformed in so many ways the retail sector and everything else. The ability to be able to go online and be able to shop and compare. What it's, and like in the computer and the cell phone side, BlackBerry was the first one out there back in the 90s. But where's BlackBerry? I mean, because when everybody talks about competition in healthcare, they always talk about, boy, when there's competition and, after a period of time, prices actually start going down and quality going up. Why doesn't that happen in healthcare? Main reason, we didn't have transparency. Now we have it.
Thanks, Tom. Why is it important to provide linkage between the disclosed provider pricing, such as quality and safety scores, by those reputable third parties?
Well, when you think about this too, and this is where healthcare is a little bit different. Many consumers, and I can understand this, perceive if prices are, for an example, when they compare and see the price and it's half the price of the MRI or the knee replacement of certain providers, their initial indication, especially as it relates to healthcare, it's half the quality.
Yeah, half as much.
Poor quality. Yeah. And then if employers are pushing you to go to low price providers, you as an employee are saying, whoa, I have a real problem with that, because they don't care about the health of me or my, dependence to that. But I know, for an example, personally, because I was involved in negotiations for years with Blue Cross Medical Mutual, pricing in the commercial market, for an example, is all a function of negotiations and leverage, and who has the leverage. So it has nothing to do, sure, there's a factor of quality, but it really comes down to who has the leverage in negotiations. And so that's where it really starts perceiving. And then data has shown that high prices, doesn't necessarily mean you're going to get the best quality. And conversely, low prices can be better quality. Yep. And obviously the converse is also true. But that's why more than ever, it's important to be able to link not just pricing, but down the road, both a lot of the quality, and not just quality ideally from an outcome standpoint, but also the safety aspect too, in regards to, infections, those types of things that might be predominant in one organization, hospital, for an example, versus others.
Thanks, Tom. Now, how will demand for the enhanced price and quality, safety, transparency impact, do you think, technology companies?
And part of what I'm trying to do here too in this discussion is really look at technology across the board. Mm-hmm. It could be technology as it relates to provider side, but lots of different technology companies, and technology is all over, and it's going to be that much over.
Yeah, as we talked, Tom, before, there's a broad audience on this call today, both from the industry of healthcare, the clinical side, the non-clinical side, vendors as well. So I think this is all impactful for, as you pointed out, the entire continuum.
Yeah, and if I was in technology, I would be really excited about my future, both personally, but, and in my area of passion, from that standpoint. But, the publishing, like anything else, it evolves. Just think about the internet and everything else and how everything like that has evolved. And so the publishing of healthcare quality and safety will evolve and become better over time. And its impact in all different areas, and we'll discuss this further today, will just grow over time, and the opportunities to be able to provide even better value will grow. And I think one of the keys is, as this demand increases, it's really a demand and supply function here. It will also become more user-friendly as third-party technology vendors in different forms want to increase market share. So capitalism at its best. So you're trying to do it, including as it relates to even like health insurance companies or other payers that are trying to do this, where they're able to be basically in a position where they're trying to provide the best, most actionable, user-friendly information. Because as you know, data for data's sake just doesn't work. It's got to be in that user-friendly, actionable way.
Thanks, Tom. How will the demand for enhanced price and quality transparency impact incumbent healthcare stakeholders? And we have a lot of them in Northeastern Ohio, such as the hospitals, insurance companies, suppliers, etc.
Well, first of all, as I said before, it will lay a foundation for a more competitive market. So when you're the incumbent, I want to put it this way, sometimes you don't necessarily want that big of a competitive market, but guess what? It's going to be happening for a lot of reasons. And going back to, and I know a lot of the listeners might be from the hospital side, part of the challenge is the hospital world, which I'll get into in a bit, because you're the big player. And when you think about it, and it, if you're in the hospital world, the big growth area, historically, hospital inpatient was where all the action was. But from a hospital side, that hospital inpatient admissions, even prior to COVID, were going down. And the acuity of the patients are going up. So in many ways, hospitals have become almost in some ways, almost like a giant ICU. I mean, it's really intense. But where all the movement is, and we see it with the closure of inpatient facilities, even here in Cleveland, is in the outpatient world, as well as what we said in care in the home setting world. Now, think about that, is that if you're a player trying to come and get market share from incumbent players, like in this case, hospitals, then you're in a position where building a new inpatient facility doesn't really, it's almost impossible to be able to do that for a lot of reasons, including resources. But competing in the outpatient world or care in the home setting world is a real opportunity. And then you add to that the ability to have user-friendly price and quality transparency available to consumers and employers. That then becomes a vehicle for you to increase market share. So it definitely creates challenges for them, but it will also create challenges for health insurance companies and others, as we talk about it later.
Interesting changes, Tom. Could you kind of do a deep dive a bit here and tell us how to enhance price and quality transparency will create challenges and opportunities for healthcare stakeholders? Could you start with the hospitals? Because we have a lot of those folks on the line right now.
Yep. And I talked a little bit about that. And this is not, a negative as it is a reality, is that when you talk about it, hospitals by its very nature have higher fixed costs. And then they also, at the same time, because of them being big players, and especially with the consolidation that occurs, not just in Northeast Ohio, but across the country, have much more increased leverage in payer negotiations in the marketplace. So consequently, they've been able to historically negotiate as much as possible higher prices to be able to increase their revenue and support their mission. Well, that's great. But then on the other hand, their prices all of a sudden in a world of healthcare transparency becomes cost visible to the consumer and to the employers. And now all of a sudden you have a challenge here. And if hospitals' pricing is significantly higher than their competitors, especially in the outpatient care and home setting, and if it is perceived as a commodity, where everything's different, and hospital pricing might be twice as high for an MRI or for a particular procedure, from an inpatient or outpatient perspective, but especially outpatient, then it will create even more of a challenge. Now, and then what it comes down to is that the big growth areas, and we haven't seen it yet as much in Northeast Ohio, but I guarantee you with transparency, we will, is that regional and national competitors coming in. And for an example, the easy one would be ambulatory surgery centers, getting involved with things like orthopedics and other areas, and, trying to compete against them at a much lower price. And they may be, from a quality standpoint, saying, guess what? We can show that we have less infections than in a big hospital system. So that creates even more of a challenge from a hospital side. And then they will obviously, too, any new entrants be going directly either on their own or through brokers and advisors to health insurance companies and to employers, showing their price and quality differences, especially the price thing, to be able to maybe put them in a position where employers start either direct contracting or developing value-based benefit designs that direct care to them at the expense, in this case, of hospitals. And then finally, a lot of these new and innovative companies, going back to technology, one of the reasons why they're able to deliver care in different ways in a much more cost-effective way is their effective use of technology. So technology shows up in a lot of different directions.
Thanks, Tom. And then what are the opportunities then for these hospitals?
Well, first of all, having that data, and I think it'll be key, is that now all of a sudden you as a hospital will understand where you fit for particular services and that against your competition, either other hospitals or other non-hospital competitors out there. So it allows you to be able to be much more strategic in regards to where you're at, how you can pick up market share, where you should be focusing on, both where you have some potential advantages or value propositions and where you potentially have some challenges. And then the other part of it too is hospitals historically had what I call a control model. They had to own all the pieces and parts. Then starting a few years ago, hospitals started to sort of change that mindset. They started to establish relationships, for an example, with rehab hospitals, what the clinic in UH has done. And then maybe they have outsourced in different ways. And I call it the make versus buy syndrome, where basically you get into a position where in certain areas, maybe as this information data comes available to you, hospital, you might say, you know what, we can't compete effectively ourselves, but if we collaborate with this third party, they have the ability to do that. So it might foster collaborative relationships, those sort of buy type relationships. The other big thing is, I really think, and I don't know if hospitals both in Northeast Ohio as well as this in the country have taken advantage of this. They really do have a competitive advantage in what I would call the risk or capitated environment, because a large teaching hospital obviously have resources. They definitely have the intellectual capital, and they have the technology that would really put them in a position to be really proactive in keeping people healthy and making them a winner in a capitated environment. Plus, think about it. If it's capitated, you own the customer. So then you sort of insulated yourself from the competitive forces. So if I was developing a business strategy, if I'm a hospital system, I would be really aggressive getting into capitated arrangements with various type of players.
Interesting, Tom. What will be the impact, though, on the insurance companies?
Well, I lived the world of insurance companies for many years. And I'm going to look at it from a number of different things. From a challenge standpoint, in some cases, they have real good contracts. And I was a health insurance executive where we had confidentiality clauses, and we wanted to, because we were the big player, wanted to protect and didn't want the other players to know, other insurance companies and my deals. And then the hospitals obviously had a vested interest too. So that opportunity goes away from that standpoint. And then insurance companies, which in many cases along with bigger insurance, including, even our local ones too here, need to have much more flexibility, especially the big area of increase in the employer market in healthcare is the self-insured employer. And they actually see the data and they want to be served because they're the ones at risk, from that standpoint. But just like the hospital, a self-insured employer now has many, many opportunities to collaborate with both regional, local, and national players to be able to, address their healthcare benefit needs. And many of these are very innovative companies and very flexible that are focusing on the needs of that particular employer. Hospitals, insurance companies historically, especially the bigger ones, I call it, have a cookie cutter approach. And the way they made money, especially with smaller groups or that a lot of smaller employers in that, is basically do everything the same and not to tailor what's needed. And their competitors in this arena, these entrepreneurial type companies, are basically much more attuned to doing some of that. Now with transparency, these disruptive competitors can really be in a position to be able to address a lot of the needs of these individuals. And they can, of employers and that, they'll be able to, from an opportunity standpoint, better be in a position to negotiate more favorable reimbursement terms with high cost providers. So where I'm going with this one is from an opportunity for health insurance companies is that, going back to my negotiating stage, if I had a hospital coming to me and saying, I want high prices, and I want the best deal, and I want, and it's really, you feel is versus the competitors much higher than you think they should be paid. Well, one of the advantages that you have, and they say, okay, if you want to do that, it's okay, but you need to know those high prices, all the employers and consumers in Northeast Ohio are going to know about it. Yeah. So, if you want it, that's okay. But guess what? You're going to have less people knocking on your doors and more people going to your competitors. And so that gives you a little bit more leverage that you might not have had before. And then those creative insurance companies that can effectively utilize enhanced technology to better serve their customers in user-friendly ways to make sure both employers and individuals have the ability to be able to make actionable decisions in regards to it. So it shouldn't be cumbersome. It should be very user-friendly from that standpoint. So that's an opportunity from their standpoint. And then as obviously, the demand increases, will incentivize to produce even more. And the more they're able to do it, I think it's going to make them look better versus their competition.
Thanks, Tom. So what will be the impact on the self-insured employers? We were talking about them before. So, it sounds like a whole new ball game.
Yeah, and it's a good ball game. And hopefully have a better ending than the Guardians, although it worked out pretty well overall for the season. But knowing that pricing information, self-insured employers who are, again, at risk, it's their money that's financing healthcare, and they're trying to compete in a world where, it's, margins are really critical. They're then able to develop collaborations with third-party organizations to develop benefit designs that, including with technology companies, that creates incentives to steer patients away from high-price providers and navigate them to lower-price, high-quality alternatives. Now, obviously, one of the keys to this is, again, price and quality, because if they just focus on the price side, they're going to have some real issues with employers, from that standpoint, employees. But, they're in a position that, they can also, based on this data, determine if there's direct contracting opportunities where they see, depending on where it is, either with a smaller provider group or as it relates to, a particular hospital or particular types of services. And then that's where, things like direct primary care and those types of things will really come in handy.
Thanks, Tom. So what will be the impact on the consumers, us, as well as the employees?
Well, yeah, the challenge is if everything was out of pocket and everybody would say, including myself, oh,
Right.
I don't want to pay healthcare out of pocket. But the fact is, as we all know, the real shakeup in, sort of the value competition out there occurs when you're paying your computer, your cell phone, your car out of pocket. And then you really are searching for the value proposition. The challenge with healthcare is, a lot of times people only have a small copay, or, they've already reached their deductible limits in that. So there could potentially be limitations, but where I'm going with this and what's happening in a very creative way is that employers as well as third-party vendors are recognizing that they need to address this issue. There needs to be sort of a carrot and stick out there from a consumer or employee standpoint that at least allows them to facilitate the transition to be prudent purchasers of healthcare services. So because you can have the data, but you got to be able to utilize it and go on it. So part of that is when you think about it, and it's really common sense, if an employer is saving significantly by their employee being a prudent purchaser, then an employer has a vested interest to share in some of those savings with that employees and create creative incentive programs that even go beyond deductibles, where they can share in the savings that doesn't force them necessarily to go in one direction or another, but provides them at least incentives to be a prudent shopper of services from that standpoint. Then clearly a key tie into this would be employee education, to be able to reason, explain to them, hey guys, we're on this, we're all in the same book. The more we're able to provide healthcare benefits in a very cost-effective manner, the more money I have to pay salaries, the more money I have to hire people, the more money I have to be profit and expand, from that standpoint. And then obviously there's always a big push for high deductible, HSAs, those types of things. And those people are actually even going to be much more hands-on when it comes down to healthcare transparency.
Thanks, Tom. What will be the impact on consultants and brokers and vendors and that whole other part of the universe?
You can imagine they're excited. Yeah, there's a lot of business opportunities. And part of the challenge, and this will be the challenge for employers and everyone else that hires them, is to make sure there's going to be a lot of smoke screens. Oh, we can do this for you and this for you. It's to separate, as they say, the wheat from the shaft, to basically understand which ones are really providing value to you. But the bottom line is they're in a position because of this, increased business opportunities. You could be a broker or whatever. You can really be a counsel to an employer that much more if you have that information. You can be much more proactive instead of reactive in regards to helping your client customer, with that type of information. Now, clearly consultants and brokers, for an example, might then need to collaborate with other third parties if they don't have those services in-house to be able to help them better serve their customers. But they're all in effect trying to not just maintain, but grow their market share. And then technology companies, if I was working for a technology company and I had that tech, I would be in seventh heaven because, this is just one more example of the new opportunities that are creating for them, but also for people that, transition and have those types of skill sets.
Thanks, Tom. Well, we can continue with the device companies and pharma and suppliers, the impact on them as well.
Yeah, there's a ripple effect. And take a look at it for those of you that work in the hospital world. That medical device, pharma, suppliers, all that, are a key part of the transition. But there's a domino effect from that. And historically, and obviously a lot has changed. For an example, medical device companies historically have gone to that physician that they had that relationship with. And then now all of a sudden the physician historically would say, well, this is the medical device I want because it's, it's the one I like working with. And things like price and everything else was a non-factor. It was more a relationship base. Well, now it's price as the challenges of transparency, for an example, face hospitals as they try to compete in this type of value-based world. Then it's going to be important for them along their supply chain, including medical device and pharma and suppliers, to be able to have value propositions. And so there is indeed going to be that ripple effect. And if I was working for any of these organizations, I need to be able to demonstrate that value proposition to my customer, in this case, the hospital, for an example. And I need to be able to maybe look at what we can do strategically in saying, you might deal with multiple vendors, but we may be able to work with you in a much more strategic way and limit the number of players that you're dealing with to be able to address the needs so that you're better able to serve, that the providers and payers to be able to provide value-based healthcare. And then, the bottom line, the medical device companies, pharma and that, technology plays a role in their world too. So they need to, if they're going to want to be a value proposition, be that much more focused on how can we use technology, for an example, to make the services we provide to our customers that much more cost effective.
Thanks, Tom. Now, do you have any concluding comments? Have you been seeing anybody ahead of the game here yet? What's your thoughts there, Tom?
Well, I think, different players. Right now, Northeast Ohio bluntly is behind other parts of the country in regards to a lot of what's occurring here. And by the way, as an aside, if I'm an organization in Northeast Ohio, from all the different stakeholders that I would talk to, because of that, you want to see what's happening in other parts of the country as it relates to your world.
And Tom, are you seeing it on the coasts, or where are you seeing it?
Yeah, in the coast, but then also like Texas, states like that, where it's a much more competitive environment to begin with, from that standpoint. And a lot of the incumbent players see that. But I think, we in Ohio, where I'm seeing more of it is from, say, some of the technology companies. I'm seeing it from some of the broker advisors working with employers in that. They seem to be understanding and getting this. The bigger insurance companies and the hospitals are a little bit slower to respond to this. And in fact, on the hospital side, and I think one of the challenges was the American Hospital Association tried as they could, and there was a lot of bipartisan support for transparency, tried to stop it or slow it down. And the fact is, I thought they were just doing a disservice to their members, because this is happening. Value-based is coming. You got to be prepared, and you need to embrace this new world rather than trying to stop it from occurring and impacting the organization. So I'm hoping to see these organizations, both the insurance carriers, for an example, in our environment, hospitals for sure, respond to this in a positive way and be that much more proactive and be able to address it, because it is going to occur. Now, I want to go back to what I said earlier, though, for the listeners of this. If you're in the systems area of any of the stakeholders that I talk to, for an example, I think it becomes even more important for you to be, aware of what's happening, recognize the importance of it, the ripple effect as it is in the future and what it's going to potentially mean, and really start thinking out of the box and really start looking for ways to better address this. and I would hope be at the table of the key decision makers within your organization. You should not be off on the side and other people making decisions on what are we going to do, how are we going to react. Ultimately, people from the technology or systems area are sort of brought in after the fact to say, listen, okay, this is what we need you to do. You need to be right there at the table, and hopefully your organization has enough foresight to recognize the importance that you have. And then finally, you as an individual from a career standpoint, your career, we just talked about the new world of healthcare being that much more technology based. This opens up so many different opportunities for you from a career standpoint. But if you stay on your little piece of the puzzle and you just narrowly focus on what's on your desk today, you're never going to get off that piece of the puzzle.
Right.
And so you owe it to yourself and to your organization to open it up. And this is where I want to give a little bit of, sort of applause to your organization, HIMSS, where, HIMSS is very proactive in both educational programs, trying to broaden and the understanding of what's happening in the world of healthcare to its members. And as both the programs that exist today, but also future programs, I think, members have a vested interest in being not only proactively involved with them, but if you think there are areas that need to be addressed for future programming or areas of interest or areas evolving, you need to work with the HIMSS group to be able to make sure they can be delivered.
Tom, besides HIMSS, you got any suggestions of where our people on our call today could go to get more information?
Well, little self-serving,
Yeah.
but it's one is we talked about my link bluntly and on LinkedIn, and I've been writing white papers and blogs for 30 years. I've been working in the healthcare sector almost 40 years.
Stop aging us, Tom.
Yeah, I know. But, the fact is I cover diverse sectors of healthcare, and I purposely do these publications and webinars, not just obviously for people from the technology area, but across the board to sort of broaden and give you a better understanding. So feel free to go on my LinkedIn page, or to be in a position you can get monthly recaps of my publications. I actually try to link in other sources of information, including studies and that could be other resources for you. And my email address, and HIMSS would have it, but it's tcamp, TCAMP, at bw.edu, if you want to be on my monthly publication. But that's just one example. And I also invite any members to reach out to me directly.
Thanks, Tom. We're at about 10 minutes or so to go in this call today. I'm going to be turning it back over to the coordinators behind the scenes. Are there any questions?
Yeah. Hey, Tom, again, on behalf of all of Northern Ohio HIMSS, thank you for speaking with us today. This has been an extremely informative presentation. A couple of questions that have come in. First, medical device vendors are also feeling pressure from hospitals to increase the cybersecurity quality of their products. Is this new transparency a help or a hindrance to those efforts?
That's a good question. It's probably a help and a hindrance. Does that answer the question? My guess is, to be honest with you, I really don't know. And, and Larry might be, in a better position to respond to this. It's, I don't see it as impacting cybersecurity, because you're not getting into, I just don't see it as impacting it. But Larry, do you have thoughts on this?
Well, I don't have a specific thought on it. When we would go through these transitions before, Tom, and we've gone through many of them, we could list them all on the wall, is to find where your organization's technology, capabilities, services play when there is this transition occurring. And actually, you mentioned the word before several times, that kind of strategic approach, because you could find that you could create a significant market differentiation between your company and others if you're able to spell this out and position yourselves in those particular areas.
Thank you.
Yeah, thank you, Tom and Larry. And a second question that has come in: how do you see healthcare organizations being successful in walking the line of providing quality healthcare and at the same time providing it at a cost point that will allow it to continue to be competitive in the market?
Another good question. I think one of the things that we need to recognize, and I'm going to focus in this case on hospitals because I know they're, as we talked about earlier, both many of your members work in a hospital or vendors are sort of tied in with the hospital world. And then the other part of this is I also mentioned during the presentation, part of the real challenge, because when you think about it, when we talk about where we're at right now, where we call it a sick care system, the hospital's in the center of that. And we as a country and a society are trying to transition to more of a health system, keeping people healthy. And that's sort of hospitals are like right in the middle, and the transitional impact on hospitals are tremendous. And we're seeing it in Northeast Ohio, obviously, with the closing of hospitals, people being laid off in some cases, new type of facilities being structured to be able to better meet the needs of the population. So you have all of this occurring. And really what hospitals, I believe, need to do is when they talk about costs, they have to have a different mindset. They can't look at things like, okay, our cost structure and our focus and the way we build things, if you want to call it, or provide care is the way we've always done it. And we got to go from there. They got to recognize that it's going to be completely different. So for an example, on the hospital inpatient side, there may need to be, not just closures of hospitals that have already occurred, for an example, but also the inpatient facilities that occur today need to be completely redirected, because we just talked about reduction in admissions. We just talked about increase in acuity. So just those particular phenomena. Now, all of a sudden, you're saying a direction of admissions. Do you need as many beds? Do you need as many people doing X, Y, and Z type services? On the other hand, with a much more acute patient, do we need to be able to have different type of technology or services? And then over and above that, for things like COVID and epidemics, we know these types of things are going to be happening again. We can't go through what we just did before. So how do we sort of close off or have enough flexibility in our infrastructure, say on the inpatient side, to be able to separate COVID patients from people that are in day-to-day type surgeries so that we don't have to shut down operations because of it. And, obviously that's a lot of challenges. Bottom line, what that means is the overall cost structure, and I hate to put it this way, a lot of it is personnel in regards to hospitals, especially on the inpatient side, need to be really reevaluated as it relates to healthcare, not just for today, but for tomorrow. And that's going to create, I think, a whole different type of mindset to going back to the original question of being, quote, both profitable, and at the same time, being a value-based proposition in a competitive market.
Thank you for that, Tom. That is all of the questions from the chat. Tom or Larry, either one, would either of you like to make any closing statements?
Well, I'll give Tom the last word here, but I'm trying to, when I look at the legislation, and you gave some very specific dates when things are going to impact healthcare, I'm looking at it from the standpoint of the educated consumer. When we've been going through this over the years, there was always the question that came from Medicare is, why does it cost X in New York City, Y in Cleveland, and Z in St. Louis, even though it's the same service and, relatively speaking, the same outcomes? Now, we all know that there are different regions and different cost structures, But eventually, if the consumer has the flexibility to make those choices, they'll start seeing the price elements in different areas and understand how it is to be a consumer of healthcare.
Yeah, no, I agree. And then also think about this, and that was part of it was a Dartmouth study actually that, really highlighted these types of differences using Medicare data. But what this will also do, this transparency, and there's third-party vendors that are actively involved working with employers on this, as well as even payers from different sides, are centers of excellence, which going back before is both challenges and opportunities. So for those providers who look at themselves regionally as just a siloed piece of the puzzle, it may not be that way anymore. Because now all of a sudden Walmart's a perfect example. Here, their little old Walmart down in Arkansas, what they do, and you see that as an employer, they're obviously one of the more proactive employers trying to disrupt healthcare, both for themselves and, and their employees, but also, as it relates to, the healthcare system itself. But back issues are a big issue. And it's either Mayo Clinic or Johns Hopkins. I think it's Mayo Clinic, where they basically send, they may have employees from different parts of the country with back issues, and they will send them up to the Mayo Clinic. Now, some of that can be done maybe through, virtual visits, but some may be actual visits. But basically looking where they may have local providers saying, oh, you need to have this surgery. It's going to cost you X. And this is what's going to happen, which potentially has all these risk factors. And Mayo Clinic might come back with, you know what, I don't think they need that surgery. We need to do this and that. And so this will create, from a competitive force standpoint, more than just in your own backyard, but open up the whole country, and all those disparities that you just talked about, Larry, I think might be addressed as part of it. Now, conversely, if you have a value proposition, then that creates even more opportunities for us in Northeast Ohio to market ourselves across the country as well as internationally as a value proposition.
Right. Well, we're just about end, Jeremiah. Is there any last thoughts here, especially for our conference in November, right?
Yeah, so just a reminder for the group, as mentioned at the start of this event, we do have our in-person fall conference happening at the University of Akron on November 17th. The registration link for that is in the chat, and there will also be an email going out about that in the near future. But again, Tom, on behalf of Northern Ohio HIMSS, thank you for speaking with us again today. And Larry, thank you for leading our discussion. And to everyone who's been with us during this event, thank you. And we hope that you have a wonderful day.
And thank you for inviting me. I really appreciate it.
Great job, Tom. Good to see you.
Nice.
Thank you.
Bye.